You're not alone, together we're strong.
Are you or someone you care about going through chemotherapy or radiation? It can take a serious toll on the body, and that's where high-dose IV therapies can really help. These treatments are designed to support your system, reduce side effects, and improve overall resilience during the toughest parts of cancer care. One of the most common is high-dose IV vitamin C, sometimes given in doses as high as 75 to 100 grams in integrative clinics. At these therapeutic levels, vitamin C may help reduce inflammation, improve energy, and even protect healthy tissue from the oxidative stress caused by chemotherapy or radiation. But safety first, you'll need a G6PD blood test before starting to make sure your body can handle it. Next is IV glutathione, often called the body's master antioxidant. It plays a critical role in protecting your nerves, liver, and cells from damage. Glutathione is especially helpful if you're dealing with neuropathy or taking platinum-based chemo drugs. It's commonly given alongside a Myers cocktail, a blend of B vitamins, magnesium, and vitamin C, which can help reduce fatigue, support mental clarity, and restore nutrients that get depleted during treatment. Another helpful therapy is IV glutamine, an amino acid that supports the gut lining. It's often used to reduce mouth sores, diarrhea, and digestive issues that come with chemo and radiation, especially for gastrointestinal or pelvic cancers. Some integrative clinics are also offering IV curcumin, the active compound in turmeric for its anti-inflammatory and antioxidant properties. While still considered experimental in some settings, early studies and patient experiences suggest it can help reduce inflammation and discomfort during treatment. There's also IV amino acid blends, trace minerals, and supportive nutrients like selenium, zinc, and magnesium, which can be tailored based on your labs and symptoms. These help rebuild your immune system, prevent muscle wasting, and support detoxification, all critical during and after cancer treatment. This is a collaborative process, and when you are ready, it will all start with a simple conversation between you and a knowledgeable provider about what will best support your healing. Integrative holistic therapy does not mean you have to give up all conventional treatment. It is often done in conjunction. These IV therapies aren't necessarily a replacement for conventional cancer treatment, but they can be a supportive bridge to help you tolerate it better and recover more smoothly. This needs to be done safely, and that means working with an integrative holistic oncology provider who understands how to time and tailor these therapies alongside your medical care. If you'd like guidance on where to start, visit FindHelpForCancer.com or give us a call at 928-546-5963. We're here to support you every step of the way. I hope you enjoyed the video. If you're in the need of integrative and holistic treatments for you or your family member, please feel free to reach out to us at FindHelpForCancer.com. We'll start with a simple conversation and help point you in the right direction. Happy to help.